everybody. Welcome to In the Know with Nina. I'm your host, Dr. Nina Crowley. I'm the Director for Clinical Education and Partnerships with SICA, where we partner with healthcare providers to offer body composition solutions. I'm so excited to be joined by my friend and colleague, Steph Wagner. She's a dietitian. She's the owner of a private practice, Bariatric Food Coach, and she's just an, in general, fun and energizing person to talk to. So I wanted to bring you on here to have a conversation about what you're seeing in your world and your practice and how that might connect to the bariatric and obesity medicine space, about body composition, because I know you've had a recent experience with that, and really just talk to folks about what we're doing in this area.
Thanks so much for having me. So fun, and I could talk to you about anything. So sounds great. Let's do this.
Well, I think one of the conversations we've been having a lot for those of us who've been in the bariatric space, so maybe you can give us a little bit about your background, but I've been in the field for almost 20 years, and we've learned so much about people with the disease of obesity that I think applies to this newer generation of medications that we're seeing. There's just so much in the media and in just common conversation about the new generation of medications, and think there's this urge for everyone to start from scratch. And I guess part of my my soapbox is that we've been doing this work for a really long time, and there's so many things we've learned about what we need to do from a programming and counseling and sort of human perspective that we can apply. The treatment option is different, but all of that other stuff is the same. So tell me a little bit about your background so we can get to kind of hear how you got here, and then let's talk about that.
Yeah. So I started in a bariatric surgery clinic. It was 2009, and I loved it. And I have never done any other job. Now with, like you said, medications on the scene, I do feel like we are kind of set up to provide unique information, even on the counseling side, like how to stay hydrated with diminished thirst. Well, bariatric surgery dietitians have been walking patients through that experience for a really long time, depending on their level of experience. So tips and tricks and things that maybe don't really come naturally, like we've been pulling those out of the toolbox, right? In my case, 15 years, how to get protein in when there's maybe some nausea, or how to tolerate the protein if it's too dense or too dry. So there's the high level of, yes, you need to get in a certain amount of protein and hydration. But there's also these like nuanced little person to person tricks. And like you said, just the experience of treating obesity as a disease. And and that goes down to everything from the size of the chair in the office to just walking alongside someone in a journey that has, just a total human element, and that you're so excited to be a part of the journey.
Yeah, it's interesting. I think that, the medication component has I think there's such a double-edged sword to it. It's really brought awareness to something that we've been sort of yelling in the background about for a long time. Mm-hmm. And we've worked with people who have the most severe, more severe levels of obesity. And I think that is a really good place to start from, learning and understanding, and that it's not just about, throwing a label on something and, prescribing a canned or, kind of one size fits all diet approach, which I see a lot of. I see a lot of this, hey, let's get a program together because we hear we're supposed to do that. I think in a matter of time, those kind of programs will fade a little bit because, it's a struggle, lifelong, eating and moving and doing all the things when you have that, excess weight or excess adiposity. And it's a lot harder than people think. It's not just take the medication, we'll make the money and be done with it. So there's a little bit of a cynical side to me on that. But on the flip side, I think, 3 years ago, I was not having to wade through research and media articles to post information about, this topic. It was few and far between. Bariatrics always felt like an other kind of group to people, and people were not, the regular person was not relating to this as something that was an option for them, even when they were, a qualified candidate. So I
Yeah.
do love, and I especially love what you're doing. You've worked mostly primarily with bariatric patients or people who've had bariatric surgery. But now I think you're seeing a lot more of kind of just like we are in the field overlap, right? You're not just a patient of one type. You're a person who may have this or that type of treatment options. And so I think that's pretty cool. You've pivoted to that a good bit.
Yeah, I mean, even, in the course of the last decade plus in the world of bariatrics, we've come a long way. And we have a long way to go. But I know we'll talk about body composition. I think about just maybe what I wish we would have done differently, over the last decade of how we would approach things a little differently. So I think that learning, we've been learning. Along the way. I mean, even I posted on Instagram last week that, when, some of the medications came out in 2012 and 2014, I was a skeptic. The surgeons I worked for didn't prescribe those. And it was really the attitude of, you just need to get back into my office
Mhm.
and we're going to get this figured out with your lifestyle. And it was really more of like an attitude of compliance rather than truly treating a disease that your body does have all sorts of different systems in place that want to regulate your body at a weight that maybe is not the healthiest, and it's not an issue of compliance. So I think I've come a long way in my own, bias and stigma that surgery is the treatment to end all treatments. And so I think hopefully a lot of practitioners have gone on that journey so that we can be better at treating the whole person. And like you said, that it's utilizing all the tools in the toolbox, not just, we're going to hit it once with a heavy hammer and, send you on your way. Even how often we see patients after bariatric surgery. I think that's hopefully changing a little bit where, at best you see a patient every 90 days for the first year, and then maybe you see them once a year. And that, kind of highlights the fact that we think that surgery should just take care of that, which that's just not, that's the day in and the day out that we need a lot more support and cheerleading with.
Totally. I remember thinking, looking at some of my notes after years, or someone would come back and be like, "Oh my gosh, I would say that." And I do remember in the beginning, it was pretty common to consider and talk about surgery as being this last ditch effort.
Mm-hmm.
I mean, I think I even wrote that into a little script or notes that I had, really making sure that they've done everything on their own prior to coming to this. And now we're realizing that actually the patients who probably have better outcomes are ones that had more early intervention from a surgical perspective. And so now I think with medication options too, we are seeing people having therapy at a lower level of obesity. And I think that's a good thing.
Yeah.
Where we're not waiting till it's, the patients who have a lot more to lose may struggle to get down to a weight that is healthy for them. So I think that's important. But even like you said, one of the big changes in the way we talk about weight, right? So
Mhm.
that had been the be all end all. And I'm a big language, kind of person. So compliance is something we could talk about somewhere else for an hour about how
Right,
people use
right.
and overuse that term. But when we're talking about weight, even like the name weight loss surgery, we had started a few years ago kind of trying to move away towards that and calling it metabolic surgery because of the changes that it has that are so much more than just about weight. But that's a hard one to change in the public perception and even from the patients themselves when we hear, they just focus on, I just want to lose weight.
Yes.
And in our community, we are seeing people move away from BMI and weight as the be all end all, but I'd be interested to hear your experience too from patient level kind of comments and questions, even when we show them their body composition, on a printout, and we kind of start with weight or BMI and then move into body fat or muscle mass. I had someone this past weekend, a healthcare provider, their first take home was like, "Oh, my weight is this." And I'm
Hmm.
like, that's the least interesting thing on this paper. There's so much cooler and more interesting and applicable stuff on here, but that's just sort of that go-to. So there's a lot of work to do still in getting people away from that focus. Are you seeing that in your
Absolutely. And I
people?
think, even going, like I said, there was things I would do differently, even with bariatric surgery, monitoring that the first thing you do after you check in for your appointment is you get walked straight to the scale, right? And like depending on how that weigh-in quote went, it kind of changed the direction of every appointment you had after that, right? And it
100%.
would be like, oh, you're doing great. Well, how do you know I'm doing great? You haven't actually taken any information, right? So there might be loss on a scale and the patient is now excited, but you go through, talk about their typical day, and there's a lot of concerns of nutritional value of the meals and so on, but it's uncomfortable then to like deflate them because they're excited about their body weight. And you're like, but
Yes.
there's actually so much more here. And I think it's not unlike, changing the focus from calories. You have someone start tracking their food and all they want to think about is calories. And to your point, like there's so much more interesting information to look at. But in our society, we think about calories, we think about total body weight. And, unfortunately, the healthcare system has played a big role in that. So hopefully we are changing the verbiage, right? Change those words. But certainly, I think total body loss. I mean, you see it also even on Instagram profiles. Somebody will put, here's my starting weight, here's my pre-op weight, here's my current weight, here's my goal weight. And so even in, that's more specifically to the bariatric community, but even that's how people kind of are identifying themselves. They're putting it on their profile and it's all
Yes.
specific to body weight. But, as you and I know, there's just, like you said, so much more to look at. Um, but there's a lot of focus on one number.
I do see more. I mean, there is more of a focus on even calling, trying to define obesity and figure out, is that just a high weight? If you just use BMI, that is what it is. But if we're actually starting to look at actual adiposity or body fat percentage as a metric that is important, we're seeing these people that are kind of on either end where maybe their weight is okay or normal weight, but their body fat percentage is high, meaning they have probably the disease markers for obesity or other chronic health conditions, or people who have a higher weight but don't have that excess adiposity or any other risk factors. And so, those are the cases where I think maybe, I don't know percentage wise how much we're seeing that, but these are important considerations and they show you why it's important to look deeper than just at that one number. I even see a lot with the visceral adipose tissue where you're able to show someone, um, maybe here's your weight and that would be high. Here's your body fat percentage and that could be high. But then you look at that visceral adipose tissue and say, you're not carrying the weight around your midsection. You're actually like maybe carrying it lower in your body. And so not having that adipose tissue around your organs actually is putting you at less risk. So that number might be in the green or in the yellow when you're looking at it on, kind of a printout. And that to me is exciting news for someone who's always just seeing red, red, bad. We
Yeah.
do that whole black and white, all or nothing thinking, good or bad. And so sometimes people even do that with the color when they're looking at a lot of red. So I do think it's important to sort of not to deflate someone, like you said, with this information, but to kind of take that in to consideration. And interesting too, as you mentioned, not doing that is the first part of the appointment.
Mhm.
I have had many stories where I've been derailed from that or from my surgeon going in and being like, oh, hey, you're doing great. Or, did you get to your ideal weight, which is some sort of like randomly,
Right.
arbitrarily picked number. And I'm like, that takes an hour to undo. And they still probably walk out and are hyper focused on that number. So there is lots to say in terms of how people attach themselves to numbers and goals and focus. And I think a lot of the work that the dietitians and the behavioral health folks do is really to undo some of that and get people thinking in a different way.
Yeah, and I think for the majority, the clients and followers that I work with, I would be really interested to know how many of them know what visceral fat is. Like, is that a word that they know that it comes to mind? I would venture to guess probably few people know what visceral fat is, which isn't that fascinating in a disease of obesity and body fat. And, there's not all fat is created equal. And like you said, there are different risk factors associated with visceral fat or subcutaneous fat, but we don't really talk about that unless they're going to a clinic that offers body composition and they have providers that are explaining the difference. And I know you've had a excuse me, a past episode on menopause, and we see, through the life cycle, you
Mm.
will have increased total body weight. And no one wants to hear that. No one wants to talk about that. But if we can normalize that is part of the life cycle, and there are seasons that there will be a higher total body weight, but that, like you said, is the least interesting number. What we're looking at is where is that fat and what is the risk factor for other conditions.
And the tricky part too of, other people or entrepreneurial spirited folks coming in to tell them, you have this is a problem, especially with menopause and perimenopause. I think it's menopause month. I'm seeing a lot on social media about that in particular right now. But there's people coming in and saying, well, we have the solution for you. So there's a lot less, here's what's happening naturally to the body. And there is a shift in body fat and fat-free mass or skeletal muscle mass over time, and more, here's how you get rid of that and all of that. So that's a tricky place to be, and
Yeah.
at a time where people probably need a little more body love and positivity.
And we could tie it too to adolescence. The teen years are another time that in the life cycle that it is very, very normal and healthy for there to be weight gain. But, our teenage girls start really worrying about their body weight, and we might start seeing restrictive diets at a really young age. And so we could go, like you said, that's another whole hour conversation, but there are different seasons or cycles or natural times in the body for there to be weight fluctuation. But that would A, need to be normalized, and B, it's not about just the number on the scale.
So how would you frame, I think, in thinking what you said, visceral adipose tissue, visceral fat is not something patients or people are hearing. In my mind too, thinking about the importance of terms not being stigmatizing or simplified. If we called it belly fat, I think that would make me cringe a little bit seeing that on an ad, bust your belly fat, right?
Oh,
Like there's stuff like that. So it's funny because I have a hard time distilling some of these nuanced, complicated topics into a soundbite. And I think that's where people who are willing to make that jump are the people that our folks are seeing and sort of internalizing those messages.
yeah, I agree. I think that's the how to communicate really complicated things, and hopefully is kind of what someone like a registered dietitian is best equipped to do. We have all this like deep deep knowledge, but translating that to our communities is it's a unique skill that we have to continue to work on. So yeah, like a sound bite to me is not all fat is created equal. We think about the word fat and everyone wants to cringe. Like you said, you see red on a paper, you hear the word fat, I mean, you just want to fall into a puddle on the floor and not have to talk about it. So even to say like it's not all created equal, and there's also there's benefit to endocrine organs, the fat on your body, but we don't talk about the good side either. So there's
Yeah.
just more conversation to have.
Yeah. I mean, the goal is not zero. The goal is not the lowest possible. Yeah, we do see that a lot with fat. And actually, I think talking about muscle health and muscle, strength and function and kind of reframing the conversation towards that has been a positive that I've seen. That was not something I think we talked too much about years ago. In kind of in that soundbite, not all weight is created equal, right? So, we do want to keep as much of our muscle mass as possible as we age and as we, lose weight. And so I think I'm seeing a lot more about that. And I would say that's a real positive because that's, fitness professionals have always, talked about that, I think. And you can always improve fitness goals. So if we're talking about goal setting, I think that's kind of an interesting talk for us too, is, a lot of times patients will say goals like, I want to lose weight. I want to, hit this number, a normal BMI, a normal body fat percentage or whatever. And those are very, you know, there's a lot of trouble with those goals. The reason I'm thinking that's problematic is like once you get to that goal, it's hard to make your goals to continue to stay
Mhm.
the same. So it's
Yeah.
kind of boring, right? Like, all right, I lost this weight. Now I got to keep that weight the same. That is not an inspiring day to day goal.
Mhm.
But like again, in fitness, you can always improve your fitness. You can always improve your muscle health and your endurance and all of those things. And so I think those make much more dynamic and compelling goals to set for somebody because you don't really ever reach a plateau.
Mhm.
There's ways to improve that, especially with the muscle mass, I think.
Absolutely. I talk a lot about goal setting for followers of my website. And we talk a lot about your leading indicators and your lagging indicators. So the leading
Mm,
indicators are the things that you actually have control over, like getting to the gym and following a strength training program. Like you can actually do that. But you don't control a number on a scale. That's a lagging indicator. You know,
mm.
it's you can put in this effort, but goals that are related to things that you actually control and are on, maybe um, it's not the easiest. So you're working through how to make this a habit in your life. But if we only make the goal something that is actually a result, it can be, you're just going to fizzle out because you're waiting for that result to show up. And I
I
just
love
think,
that. I love
yeah,
that frame. Actually, that's the perfect way to put it. I see, like I would have a long, nuanced answer, but that's the like clear way that makes it's a memorable way to
yeah.
connect with that sentiment.
I was thinking too, um, you know, 2010 maybe when I was in a certain bariatric clinic, which I loved. We had a Tanita scale, and I remember that you would get this little like ticker tape receipt, and I think we did it at the pre-op visit, and we did it like 1 year later. So it was really we weren't really tracking it for you
Mm,
know fat-free mass or body fat percentage. It was more like, oh, you're at your 1 year celebratory surgiversary appointment, and now we're going to look at this. And I also don't think that that data was really tracked. It was more like, here's your little paper receipt. Can you find this a year later? And is it legible a year later? Uh, so, I feel like we would talk just anecdotally, like, when you have extreme weight loss, you're going to lose fat, you're going to lose muscle, you're going to lose bone. We want to preserve the bone and the muscle the best we can. Resistance training is a great way to do that. Protein in your diet is a great way to do that. But we weren't really tracking that. So at that 1 year appointment, it was way more like, wow, look how great you've done. But it
mm,
wasn't truly using that data to understand the total body change. And it wasn't frequent enough.
totally. And yeah, that's a really good point. I think we've come a long way from even just the cloud, like using a cloud-based system so that you can see these results over time. I love when I see a results sheet from someone who's got a bunch of checkpoints because it illustrates visually the point that you're trying to make, which is look, these numbers kind of move up and down over time, right? They're like just like your goals and things that people want to be perfect and black and white in this like straight line. It's not. It's up and down, but like look where you were a year ago and look where you are now and like that is how you get there. It's not linear, really.
Yeah.
And so I think that's a really good point. And being able to visualize that and then check in with, connecting that to what was going on at the time or how they were, able to make changes to their diet or their exercise regimen alongside that. I think that's huge. So yeah, that's where I see, and that's where I'm excited to have body composition around for surgical or medical patients who are seeing a big change because it's so much more than just that, hey, your weight went from point A to point B. There's a
Mm-hmm.
lot of other really inspiring or, areas for opportunity to focus on there.
Yeah. And I know you and I have talked about home scales, right? So let's talk about that for a minute because I get that question quite a bit. Like, well, can my home scale do that? So just anecdotally, I did a body composition with a Sika scale. I went there. I'm in Kansas City, and I was able to just Google, and I went in, and they had just It's just basically a standalone clinic where you can go do things like body composition, VO2 testing. So there's
Mhm.
not clinicians there, there's not providers there. You're just getting the testing. And so I was able to go do that. And then I compared that to my home scale because I was curious. You always hear the home scale is not as accurate. And there was a 9.4% difference for body fat from the Sika scale to my home scale. Um, so certainly the accuracy isn't there, but what, in your opinion, do you feel like is like the best use of these home devices and how someone might use, like you said, use it to look at the trending
Yeah.
data?
Yeah, I get that question a lot because people want us to have a one that they can use to connect with their scale in the, the clinical grade one in the office. We don't have that at this moment, but I do think that there is a role for people to track some of that stuff on their own, and see trends, right? To see how things are going. But I've worked with patients and people long enough to know that these can be obsession points and people can get a little bit too over focused on their lagging indicators. So I'm going to steal that and start using that from you because,
You're welcome.
I would always say, the numbers that you can't control. Like if you could control the number on the scale, we'd be in a whole different place. And the problem after a surgical procedure, or probably in the early days of medication too, is for the first time, people are feeling like they can control that number.
Mm-hmm.
And it's important that you check in with that. You never could, you won't be able to control the outcome, the lagging indicator, but you can control the daily stuff that gets you there, and put those things in their place as outcome measurements of the things that you're doing day in and day out. So I think without the provider to continually reinforce that message, if you only had a home scale, you wouldn't get that. You wouldn't, have that reminder that this is just a piece of data. This is just a piece of information. And what I saw happening, just like with weight, right? Like it's going to fluctuate. You're going to see those numbers go up and down. There's changes in our body every day as we put things in and out of our body, right? And I would see people get so hyper focused that they would like eat a breakfast option, see the number move,
Yep.
say, oh, that was bad. I'm going to not eat that particular breakfast. And so it would be a demotivator for some really healthy behaviors that,
Mm-hmm.
if repeated, could become long term habits. And
Mm-hmm.
that's something that's sort of a downside. So I do see a little bit of a behavioral downside to too close monitoring of body composition at home, because you're not going to be able to change your actual body composition at home that frequently. It takes a little bit longer to do that. And so I think it done right and in the right place, maybe you can send a block to the data being transferred, and that you only can do it once a month or something like that, if we could do that. But I
Yeah.
see it, there's a lot of technology things, like even just thinking about our own, Apple watches and some of the rings and all these other things that we have now. There's a behavioral drop off of how that new exciting too much data kind of has an impact, and you're not necessarily using it constructively for the long term. But that's me in that kind of boring long term chronic disease mindset, where I think a lot of what we see is this exciting, quick, in the now, rapid weight loss type stuff. And so of course that's going to seem new and shiny and exciting, but I care about, are we still doing it a year later? Is
Yeah.
seeing that number and that information at home that frequently, is that something that works? And again, I'm also very patient centered. So, which means you have to take what someone's telling you and what they're saying. Like if someone's saying this kind of data works for me, I had a lot of really, I would always say, like the accounting guy would be the typical guy, right? Like someone who really likes and needs those data points. And that might be the exact right way for him or her to monitor their outcomes.
Yeah.
Doesn't work for everybody. So I think we always have to say there's not going to be one, full solution that works for everybody. But in my mindset, there's a little bit of that trickiness when it comes
Yeah.
to behavior.
I'm with you. I think it's always helpful to do a little bit of like self-reflection on is this truly helpful for me in my wellness and my mindset in the whole overall picture. I did a rabbit trail several years ago, and I kind of go back to it from time to time about the history of the home scale. When did we start doing this? And it has origins back to like the 1920s. Before that, they only had scales at train stations. like, uh, oddly enough, like, so it's just interesting thinking about the evolution of when did we even start doing this? When did we decide to step on this, metal device on the floor and see what the weight was that shined back at us? Like, I feel like it's really interesting. And I mean, certainly it has clinical use, right? Like, I would like anyone that's going to be dosing my medications to know my body weight so that they get the dose appropriate. So it absolutely has clinical value, and we use it still in diagnosing the disease of obesity. It still has a clinical piece there, but how helpful is it at home in the day in and the day out? I don't know.
Well, I think we've come a long way, and I think our field has come a long way. We still have so much work to do, but I'm really happy to be in this space right now, because I think your experience and I think mine are really good examples of what people can provide to those who have the disease of obesity and who just are kind of thinking chronic disease in general. We've got a lot to offer, and I think there's a lot we can learn from looking back on that. So on that note, how do we stay in touch with you, or if someone wants to connect with you, what are your best ways to do that, Steph?
Yeah, thanks for asking. So find me online at bariatricfoodcoach.com. And of course, it's the same handle on any of the other places. But yeah, I started, back in those years of working in bariatric clinics, and I loved it. I just wanted to provide more help for the day in and the day out. Because like I said, best case scenario, I see you for 30 minutes once every 90 days. And I wanted to provide more. So Bariatric Food Coach is a website that provides help in the day-to-day in between your visits with your providers. And that's anything from recipes to continuing education to menus. So that's where you can find me, bariatricfoodcoach.com.
So, well, thank you so much for this conversation, and I know we'll have lots more at our next meeting that we'll probably be at together in a couple months.
Thanks so much.
All right, have a good day.
Bye.